New at 5, is the U.S. the most dangerous country in the developed world, it's hard to believe, to give birth in? There's a new USA Today investigation that says yes.
And perhaps even more disturbing, the research finds most of those deaths are preventable. Team 12's Nicole Zymek verifies where Arizona stands. Nicole?
Guys, not only does the U.S. have the highest pregnancy-related mortality rates in the developed world, that study reveals it's increasing.
USA Today finds 700 women a year die of pregnancy-related causes in the United States, and that number is rising. A 26% increase between 2000 and 2014, all while the rest of the world has seen a 44% decrease. As for the Grand Canyon State, the Arizona Maternal Mortality Review verifies an average of 9 women die of pregnancy-related deaths in Arizona every year. More disturbing, the review finds 89% of those deaths were preventable. But why? Dr. Michael Foley is one of the doctors USA Today interviewed. He also does a lot of national work to educate doctors in preventing maternal deaths.
We begin the education process now, so I think number one is we get moms to the doctor earlier.
He believes one of the biggest problems in hospitals with high mortality rates is they're not prepared for complications like high blood pressure, women giving birth at an older age, and excessive bleeding.
That's probably one of the biggest ones. We call it postpartum hemorrhage.
That happens in about 5% of women.
And we can't always prevent those postpartum hemorrhages. What we can, though, is prevent the degree of postpartum hemorrhage. And what we ended up doing at Banner is that we instituted a checklist protocol.
Dr. Foley has seen great success with checklist protocols.
We're focusing most on what we can do.
Now, there is some good news. The Arizona Maternal Mortality Review does find that the number of pregnancy-related deaths is actually trending down in our state. Nicole Zymek, 12 News.